In the United States alone, 1,600 people are diagnosed with listeriosis. Out of these, 260 people die from the infection. Hi, my name is Diya Sethi, and I will be presenting the disease listeriosis. Today I will be going over the following topics. I will go over background, people at risk, usual symptoms for high-risk individuals, diagnosis, and treatment. I will also go over complications, prevention, my experiment, references, and then I will open the floor to any questions, comments, or constructive criticism. Here's some background and information about my disease. What is listeriosis? Listeriosis is a mild infection caused by the bacteria L. monocytogenes. The bacterium is found in soil and water and is transmitted from plants to animals and then to humans. It is a foodborne disease and is also called listeria. Listeria is caused by the consumption of contaminated processed foods, poultry, meat, seafood, dairy products, or vegetables. People at risk. Everyone can contract listeria, however, certain people are more likely to get the disease. At least 90% of people that develop listeria are in a higher risk group than others. People with weak immune systems are at a great risk of developing the disease because their immune systems cannot fight it off. Other people who are at a higher risk of developing the disease are people with different medical conditions such as HIV or AIDS, diabetes, liver and kidney disease, alcoholism, end-stage renal disease, and cancer or immunosuppressive therapies. Immunosuppressive therapies include chemotherapies, steroids, and radiation. Organ transplant patients who receive drugs to prevent the body from rejecting their organs are also at a large risk. Newborns and adults over the age of 65 cannot fight off the disease as their immune systems are either not fully developed or are weakened. Adults over the age of 65 are 4 times more likely to develop the disease, and 58% of listeriosis cases occur with people above the age of 65. Pregnant women are 10 times more likely to develop the disease. 1 in every 7 cases of listeria occur during pregnancy. Developing fetuses inside the bodies of pregnant mothers are also at a huge risk of developing the disease from their mothers. Symptoms appear between 3 to 70 days after receiving the disease. Some of these symptoms include headaches, stiff neck, confusion, loss of balance, fever, and muscle aches. Other symptoms include weakness, vomiting, and occasionally convulsions or diarrhea. These symptoms last from days to weeks, and there are different symptoms for high-risk individuals. Pregnant women will only experience flu-like symptoms. After the baby inside the mother is born, they may still be infected. If this is true, symptoms will begin to appear within the first few days of life. These symptoms include loss of appetite, lethargy, jaundice, and respiratory distress. Other symptoms include shocks, skin rash, and vomiting. Diagnosis. When an individual experiences symptoms, he or she should visit a doctor immediately. The doctor will perform a test, normally a blood or spinal fluid test. Sometimes a urine or feces test will be taken. They will study the sample and locate the bacteria. The bacteria will take 1 to 2 days to grow. The doctor will then report back to the patient and help the patient terminate the disease. Treatment. When there are minimal symptoms, there is no treatment that is necessary. When there are mild symptoms, however, antibiotics such as ampicillin and trimethoprim sulfamethoxazole are used. They are used to kill the bacteria. In pregnant women, prompt antibiotics are needed to ensure that the baby does not get sick. For newborns, there are a variety of antibiotics that are needed. If listeria lasts for more than 2 months within a high-risk individual, intense medical care is needed. Listeriosis may still cause death, especially in infants and fetuses. There is a very small chance of survival for these treatments. Complications. In adults, some complications may include heart infection, brain or spinal fluid infection, lung infection, or a blood infection. In infants, there is a chance to have long-term brain or nervous system damage or delayed development. For general high-risk individuals, there is a large risk to receive septicemia or meningitis. Septicemia is characterized as a blood infection, whereas meningitis is inflammation of membranes or fluids surrounding the brain. Most children 5 days or over develop meningitis from listeria. Pregnant women are at risk of having a miscarriage, stillbirth, premature birth, and the death of their infant within a few hours of birth. The baby can also inherit a different fatal infection. 50% of fetuses infected with listeria near the end of the pregnancy term will die. Prevention. There are many prevention methods for listeria. In relation to cleaning, wash hands constantly, especially before and after handling or preparing foods. Wash all utensils, cutting boards, and other food preparation surfaces. It is important to consistently wash refrigerator walls, shelves, and other segments. The refrigerator should be kept at 40 degrees Fahrenheit, and the freezer should be kept at 0 degrees Fahrenheit. This must be done so that L-monocytogenes will not grow. In cold conditions, L-monocytogenes can continue to grow, unlike other diseases. Raw fruits and vegetables should also be washed and kept clean. Foods such as meat, poultry, and eggs must be properly cooked. These foods should also be stored properly and where they belong. It is vital to consume pre-cooked, perishable, or ready-to-eat foods by the use-by date. Avoid raw or unpasteurized milk or food containing unpasteurized milk. Additionally, keep uncooked meats, poultry, and seafood away from vegetables, fruits, and cooked ready-to-eat foods. Prevention for pregnant women is stronger. They should avoid eating meats and seafood. They should also avoid consumption of soft cheeses, deli meats, foreign foods, non-pasteurized cheeses, and cold salads. They must also avoid feta, queso blanco, queso fresco, brie, camembert, blue bean cheese, and panela. Prevention for high-risk individuals is enhanced. Ensure that all products are completely cooked. Heat all hot dogs, cold cuts, and deli meats before consumption. They should be steamed hot. The fluid from the hot dog packages should also be kept away from food and food preparation surfaces. Additionally, wash hands directly after handling these meats. Next, do not consume refrigerated pâtés or meat spread. Canned or shelf-stable meat spreads are acceptable to eat. Smoked seafood should not be refrigerated unless put within another dish. Canned or shelf-stable seafoods are safe to consume. In recent years, there have been 4 outbreaks of listeria. The first outbreak occurred between August 2011 and October 2011. The spread was caused by cantaloupes from Jensen Farms in Colorado. There were 147 people who were infected, causing 33 deaths. This all took place across 28 states. The second outbreak occurred in 2012. It was caused by Frescolina Marte ricotta salate cheese imported from Italy. 22 people were diagnosed, while 20 of these people were hospitalized. 4 deaths also occurred. This occurred across 14 states. In 2013, Crave Brothers farmstead cheeses were infected. 6 people were infected with the disease, and all 6 were hospitalized. 1 death occurred. This occurred across 5 states. This year, Bruce Foods Dairy Products was infected. 8 people were diagnosed with listeria, and 7 of these 8 were hospitalized. 1 death occurred. This occurred across 2 states. Now I'll review an experiment I researched relating to listeria. Some background information that was gathered to help the scientists is that L. inoca sometimes grows with L. monocytogenes. L. inoca affects the growth of L. monocytogenes. This experiment was performed in 2010. The objective of my experiment was to evaluate the influence of L. inoca on the growth of L. monocytogenes, and to compare the growth of these 2 species individually or concurrently in different species. Methodology. For this experiment, different strains of L. monocytogenes and L. inoca were used and watched using the microplate method. This means that different solutions were added to the microplate and was incubated for 24 hours. It was then watched at 30-minute intervals. The experiment was repeated at least 3 times. The scientists analyzed the effects of survival for both bacteriums and compared to the other. The calligraph program was used for calculations. Results. The scientists compared the results depending on the generation time, growth curve of initial and final rate, and the growth rate. In some cases, there was no direct correlation between the strains. In one case, cell reduction of L. monocytogene was recognized. In another case, the amount of L. inoca cells were 10 times more than the amount of L. monocytogene cells. Conclusion and further research. The inhibition of L. monocytogenes by L. inoca was consistently observed through the results. With more research and more isolates, it will be easier to characterize the interactions and to determine the cause of inhibition of some strains by others. In conclusion, listeria Listeriosis is a foodborne pathogen. Infants, adults above the age of 65, and pregnant women are also at a higher risk of contracting the disease. Symptoms include fevers, muscle aches, and more. These symptoms can be treated with antibiotics. Lastly, to prevent the disease, proper cleaning and cooking techniques should be used. These are my references, and I will now open the floor to questions, comments, and constructive criticism.
If you have a question, raise your hand.
Can it only be found in soil or water, or can it be found somewhere else?
The origin of L-monocytogenes is from soil and water, but it can spread from soil and water into plants, and then also or into animals, and then it can spread to more people. So it can be found. There are no vaccines for listeriosis.
What was the age range for children that have coronavirus?
They have to be 5 days or older, and it ranges to about toddler age.
What's the mortality rate?
It's about 260 people a year just in the United States.
Why should a pregnant woman not eat seafood when seafood is good for her?
There's a great chance of the seafood being infected with L-monocytogenes because a lot of times seafood's not fully cooked or it's made raw, so they could contract it.
What's a pate?
A pate is a spread made of a mix of just different meats and